Hello, one and all. I am Dr. Aman Upaganlawar. Today I am presenting my research work on effect of virgin coconut oil and curcumin on biochemical alterations, markers of oxidative stress and histopathological changes in streptozotocin-induced diabetic nephropathy in laboratory rats. So initially the introduction. As per IDF in 2019, diabetic patient worldwide will grow near by 578 millions by 2030. Diabetic is a leading cause of morbidity and mortality in nowadays, and as per this guideline, it was suggested that up to 2030, throughout the world, 578 million people will suffer from the diabetes. Out of that, 30 to 40% patients with diabetic mellitus, they develop diabetic nephropathy. It means it affects the kidney functioning, and various mechanisms are involved in the development of nephropathy. In that, oxidative stress plays an important role, which is also one of the contributing factor for development of diabetic nephropathy. Virgin coconut oil and curcumin, they are reported to have good antioxidant property and they produces the synergistic effect. Considering this, the objective were made. The first objective to study the streptozotocin-induced diabetic nephropathy in the rat. Second is to study the role of oxidative stress in pathogenesis. And third is to check the effect of virgin coconut oil and curcumin on diabetic nephropathy and associated parameters. So this is the experimental protocol where the animals were grouped in different groups, and the curcumin, it was procured from the reputed supplier. Virgin coconut oil, it was freshly prepared from the coconut, and the whole protocol was approved from the ethical committee, that is ethical approval was taken. The animal was grouped into 5 different groups. First is the control, which received the citrate buffer. Second group is the streptozotocin inducer. The dose was 60 mg per kg intraperitoneally. And group 3 treated with virgin coconut oil, 8 ml per kg per orally. And group 4, it is a curcumin plus virgin coconut oil. And group 5, virgin coconut oil plus curcumin. So this is the lower dose of curcumin. This is the higher dose of curcumin, which was used in this treatment part. So animal was treated with STZ 60 mg per kg, and after 72 hours, the induction of diabetes was recorded. And those animals which shows promising hyperglycemia, they were further kept for the 4 weeks for the assessment of development of nephropathy. And during that period, the urine protein was tested. After 4 weeks, it was observed that the protein level was high, indicating that the nephropathy was developed. At that day, the animals were grouped into different 5 groups, and as it is indicated, and further the treatment was continued for 4 weeks. At the end of 4 weeks, means at the end of total 8 weeks, the animals were sacrificed and various parameters were evaluated. This is the effect on this virgin coconut oil curcumin on body weight and feed intake. So it was observed that in treated animal, in a diseased animal, the body weight and feed intake was quite variable. Here the significant reduction in the body weight was observed, and here the significant increase in the feed intake was observed. But the treatment with the combination, they does not show any significant alteration, but it was slightly improved in both these parameters. This is the effect on virgin coconut oil and curcumin on water intake, kidney weight, and urine volume. It was observed that water intake was significantly increased, which was reduced in combination. Kidney weight was significantly increased, and here you can observe the combination shows a significant reduction in the kidney weight, and urine volume was also significantly reduced. So this kidney weight and urine volume, they are most preferably the nephropathic parameters, and they were significantly improved with the treatment. Then the several biochemical estimations was carried out in the urine sample. It was observed that the total protein, creatinine, albumin, urea, and all this level was significantly alters in the disease condition, which was improved with the virgin coconut oil and curcumin. Then the markers of oxidative stress are very important to know the involvement of oxidative stress in a particular disease. So here in the kidney sample, we have evaluated 4 endogenous antioxidant like SOD, catalase, GSH, and lipid peroxidation. So here it was observed that the level of SOD, catalase, and this GSH was significantly reduced in the disease condition, and the treatment with the combination shows a significant improvement in these parameters, whereas lipid peroxidation, which is estimated as a malondialdehyde content, and it was observed that LPO level was significantly increases, which was reduced to a significant amount after administration of virgin coconut oil and curcumin. The brush border enzymes also plays an important role in the kidney. So here we have evaluated sodium potassium ATPases, calcium ATPases, and magnesium ATPases in the in the sediment. After centrifugation of the homogenate, we get supernatant and the sediment. The supernatant was used for estimation of endogenous antioxidant level, and the sediment was used for the estimation of these 3 enzymes. So it was observed that in disease animal, all these 3 levels was significantly increases, like sodium, potassium, calcium, and magnesium ATPases. Whereas treatment with this virgin coconut and curcumin shows a significant maintenance of or towards the normalization of this brush border enzyme. Histopathology of the kidney is very important in this study. So here we can see any damage to the nephron and glomeruli. So it is a control animal where you can see a prominent nephron and glomeruli, whereas here there is a significant disturbances observed in the diabetic nephropathy group. This is a treatment group where you can observe some alteration, but it was not significant as considering the disease group. Then in conclusion, the oxidative stress plays an important role in the pathophysiology of diabetic nephropathy. Treatment with virgin coconut oil and curcumin protect the diabetic nephropathy induced by STJ in experimental rats, and the combination shows better activity and dose-dependent activity than alone. This effect might be due to strong antioxidant activity of both the compounds. These are some references which are related to the study, and I acknowledge Academy of Excellence in Biosciences for supporting the registration fees in the form of sponsorship. Thanks one and all for listening this presentation. Thank you.